I'd like to convene the,
Get your mic on.
let's see,
It's on.
it's on. At this time, I'd like to convene the monthly meeting of the Indian River Hospital District. At this point, I'd like to call upon Rabbi Bernholtz to provide us with an invocation.
So what an honor to be able to gather here at this meeting for our community. As you get ready for this meeting of the hospital district, I offer this simple story. A man asked the Kotzker Rebbe, that's the rabbi of the city of Kotsk, to pray for him in order that his sons might study the Torah diligently. The rabbi, he replied, "If you're diligent in study and your sons see it, they will imitate you. But if you neglect your own studies and merely wish them to study, they'll do likewise when they grow up. They'll neglect the Torah themselves and desire that their sons do the studying." And that's always the real challenge as we gather here in these moments of community and community leadership. How do we in our functioning, how do we in our discourse, how do we as we wrestle with the debates, the discussions, and decisions we make, how do we do it in a way that lives up to the values, to our hopes and dreams of what we hope to see out in our wider community? And so I offer the simple prayer as you gather here in this place. Adonai oz li'amo yutain, Adonai yivarech et amo v'shalom. As you are gathering here in this place, may you find courage and strength and patience with each other that you hope to see in our wider world, so that in partnership in this place and beyond, we can make our community one of shalom, of wholeness, harmony, and peace. Amen.
Thank you.
Thank you very much. At this point, we'll have the Pledge of Allegiance. Join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very much. At this time, I'd like to let it be known that Mary Beth is not here tonight, neither is Alan Jones, but they are here physically through the telephone, thanks to our telephonic era. So they will be participating in this meeting. At this point, good. You're there? Okay, very well.
We are.
At this point, we'll go through the consent agenda. We have the approval of the chairman's meetings dated July 17th, the regular meeting minutes dated July 18th, and August disbursements of $939,686.47.
So move. Second.
Was there a discussion? Then we'll call the motion for a vote. All in favor?
Aye.
And no nays, the motion carries. At this point, I will turn the meeting over to our district council, the Honorable Jennifer Peschke.
Thank you, Dr. Weiss. It's been another busy month as we work to make the transition with the Gifford Health Center, with TCCH operating the facility. So we've been working on the lease that has been finalized and signed with Treasure Coast, and also the Healthy Start sublease has been signed and finalized. And regarding the We Care sublease, Anne Marie and I met with Dr. Saver this morning on that topic, and we are in final negotiations on the matter and expect to work through this to a resolution within the next 30 days and hope to be able to present you with a final signed sublease at that time. I've also worked again on matters as they arise with regard to the upcoming budget cycle meetings and materials, as well as all monthly meeting minutes have been reviewed, as well as special meeting minutes. And of course have responded to questions from each of you as they've arisen over the course of the month, and continue to be available to each of you at any time as needed. Does anyone have any questions? Okay. Thank you, Mr. Chair.
Questions? I'd like to thank you very much for a very nice, concise report. At this point, I'll turn the meeting over to Anne Marie Soriano, our Executive Director, for her report, for the financial statement and review.
As thank you. As Dr. Weiss just said, Alan Jones is here on the telephone, so if you do have questions and as I continue, he can assist in answering those. But he has submitted a financial statement review indicating that as we're approaching the end of the year, we have received the bulk of our tax revenues, and our bank account is sitting at a little under $7 million, $6,958,000. And after we pay our $936,000 bill of bills that we've just approved, that will leave us with $6 million. So we are in a very sound financial position and are able to finish the rest of our year. So unless there are questions for either of us.
Any questions? Thank you for a good report as always. Now I'll turn the meeting over again to Anne Marie Soriano for her Executive Director's report.
And again, my report is in your packet, I think, for review. I didn't see it in my own, but unless there are other questions, Jennifer did indicate we did have a good meeting with Dr. Saber this morning, so we'll work through. I've indicated in my report, just for the public's purpose, that the health department has completed their move at the Gifford Health Center. We've been in there doing some inspection and now getting some prices and doing some repairs to that building that needed to be done as it ages. So that will be in a clean condition for Treasure Coast Community Health. They are moving in as we speak and are on target to begin services again on the 26th of August. We do have the mobile unit on site 3 days a week, and it is at the Gifford Youth Achievement Center, 1 day a week as well, so it is providing some services in that community. Miranda's going to do her report, so she'll speak to anything else as far as the health department on that matter. So other than that, if there are questions about my report, I'll answer those.
Are there any questions? Seeing none, I'd like to again thank you very much, Ms. Soriano, for a marvelous report, as usual. And now I will turn the meeting over to Tracy Zudans, a trustee, who's also the Gifford Health Center Advisory Committee representative for us.
Good evening, everyone. We had a meeting on August 8th, and we've been meeting as an advisory committee about every 2 weeks, and we are going to continue to do that until we get through the transition. Everybody that is part of the advisory committee is participating in some way with the Gifford Health Center and the transition, or as a member of the community at large, or the Gifford Health Council, et cetera. It is, again, everybody's been participating and working together. And at our last meeting on the 8th, we were revising our Looking Out for You document that we've been kind of using as what we would consider like rumor control, or discussing questions or any concerns that any of the members of the advisory committee have or that have been brought to them. And we discussed it we had one update because there was a question about are the meetings open to the public? And of course they are, and we actually have a statement saying so. It is, any meeting is open to the public. It is actually easier to, if you have something to discuss at the meetings, to call Anne Marie Soriano for here, to get put on the agenda so that we can allocate enough time so that you can be heard. But again, always welcome. And when we update the Looking Out for You document, we distribute that to the 5 pillars, all the members of the advisory committee. We share it with the Gifford community at large, and we also, the VNA has been, and and Pat Nepris has also been gracious enough to have it done in Spanish as well, translated into Spanish. So as soon as we can finish up with that, we'll go ahead and disseminate that updated one by the next meeting as well. We were talking about clinic charges, and there was concern about sliding fee scales and whatnot, and a question of what the services were going to be that were offered at the Gifford Health Center. And so TCCH was gracious enough to put together a just general menu of services available. And as we get closer to coming up with what their sliding fee scale or what those actual financial figures and charges are going to be, then those will be actually added to the statement. And once those are added, then that will also be distributed to all the people on the advisory committee as well as the community at large. TCCH has several sites in our community, and so whatever decision is made has to go through their board, and their financial committee has to come before the trustees for approval. So it does take a little bit of time to go through that process, but they are actively and quickly working through all of that in hopes that we can have all this available before opening day on August 26th. There is going to be, we've been working on our subcommittees as well. There's going to be an open house, which is being planned and scheduled still for September 13th from 5:30 to 7 at the Gifford Health Center. Pat Nipper is heading up our resource fair portion, and they are working very diligently on doing that, and that is currently scheduled at the Gifford Youth Achievement Center for November 2nd from 10 to 2 p.m. And as we get more details on any of these things that the subcommittees are working on, we will obviously share those with the community as well. So we also were, there was a community health worker that was being interviewed and searched for TCCH for the Gifford Health Center. And in doing the interviewing and going through the advisory committee, it really did come about that it wasn't really so much a health worker that was needed. It was really more of a patient advocate and a coordinator of services that was needed. And so they did go through that interview process, and Janae Brown was recommended, and she accepted the offer. So she was our community at large person, and so that position is currently vacant, and we are working towards filling that as well. But Janae Brown did accept it, and we're excited to see where that new position takes her as well. So congratulations to her. With that in mind, we do have about a few weeks before we will be making recommendations for another community at large person or recommendation. We have a meeting scheduled currently for August 22nd, and we're hoping to have some recommendations for a person to fill that position at that time. The clinic is doing really well as far as going through its transition. The Department of Health and TCCH and all the Healthy Start and We Care are all working together towards making that transition as smooth as possible. And that's all I have so far. Did I miss anything? Are there any questions for me?
Tracy, I do have a question.
Absolutely.
You did say the advisory committee was open to the public.
Sure.
Where is that posted for the listening public?
The meetings are, if they're not on the website, they will be on the website, or you can always, it's probably easier to call the hospital district, because during the transition right now, we have to make accommodations for where we meet. So we are either meeting at the Gifford Health Center in the conference room, or we're meeting at the hospital district, and that is based on where we are in the transition. We do not want to interfere with the transition or step on toes or make it inconvenient for them, because at opening day on August 26th, we want them to be spot on ready.
Oh, the reason why I ask is, first of all, where are you going to meet? Because I know Gifford Health Center, the room is
Right.
not, you can't accommodate too many people there.
And it is recommended also, though, even though the meetings are open to the public, the advisory committee has a member from each of the different parties involved, and so sometimes, and each member of the advisory committee is charged with bringing back to these meetings any concerns, any questions, anything like that, and then going back and get with the answers or solutions and disseminating that information to their respective organizations. So always welcome. Sometimes it's easier for the sake of time to go through whatever organization you're interacting with or have a question about, but always welcome.
Probably a better idea.
Yeah.
Rather than to
It-
inundate.
That's the way it's been going, and it's easier that way, but by all means, if you want to come, and if you want to be on the agenda, just call Anne Marie so that you can be put on the agenda, so that we can make sure that you have enough time to speak and that your questions or concerns can be addressed.
I'd like to congratulate you, though, on this. You're doing a great job.
Oh, thank you.
I was just going to say the same thing. Congratulations. It's
It has,
okay. You've done
honestly,
an
it has,
amazing job,
it really doesn't have anything to do with me. It really has to do with the group and the community and everybody collaboratively working together. Everybody wants what's best for our patients in our community and the residents of the Gifford community. So it's been a pleasure working with everybody.
Well, thank you for representing
Thank
us
you.
because you've done a great
My
job.
pleasure.
Thank you. Now I will call upon the, our
Tracy,
funded-
can I ask a question?
Absolutely. Sorry.
sorry.
Okay. I'm sorry, I was on mute saying, can I ask a question? I think you guys are doing an awesome job of doing this, and it's all the people together, so thank you all for that. Do you get a feel, or do you have any feel for the community in general, and is there anticipation or excitement, or, I mean, are they happy?
I think it's a little.
Any feeling?
There's a little bit of unknown right now. So I think there's anticipation. I think there's a little fear of change as well. I think I think once everybody gets in there and kind of everything settles a little bit and relationships are built and trust is built in that community, I think you're going to see a lot of people very excited to have a full range of health care in the Gifford Health Center again. But so far, so good.
Great, thank
Thank you.
thank you.
Barring any other questions at this point, we have the funded agency quarterly report. And we'll call upon Miranda Hawker of the Florida Department of Health for Indian River, the health administrator.
Wonderful. Thank you. And thank you for having me here tonight. I'm here tonight to give you our quarterly update, although I have done it from October 2018 to June 30, 2019. So pretty much year to date. Today is our last day of doing primary care and dental care services within our clinics. So it's a rather timely update.
Bittersweet.
Yes, in terms of our sites, our total visits over that period of time, that 9 months. So at our main site, our district visits were 1,036 out of a total of visits of 5,184. 20% of those is what it equates to for district visits. Dental, 1,359 district visits, 2,965 total visits. 46% of those were district visits. And then, of course, Gifford Health Center was 393, total 3,783 for a total of 13% of district visits. When you look at our payer source in terms of our client mix, and this really has stayed the same over time, and this is just year to date, so January 1 to June 30. And when you look at our payer mix, and this is clients, not visits, about 88% were under 150% of federal poverty, for a total of 2,757 clients. Roughly 10% were Medicaid, 5% Medicare, 15% roughly, if you round up, private insurance, 10% managed care, and then about 60% self-pay. And historically, that has been the same kind of proportion over time that we've seen at our main site. Dental, we had a much larger proportion in terms of 96% roughly of less than 100%, 50% federal poverty. 1,087 clients there. Roughly 36% were in managed care, and then 62% were self-pay. Gifford Health Center, which was pediatrics for a majority of the time, here we had a much greater majority that was in managed care, but still about 40% within self-pay, and a great number of people that were 91% that were less than 150% federal poverty. And here you can see in the second quarter and really the last part of the year when we started scaling down, you can see that our numbers in all of the categories started to drop. And this is just at the Bureau site, not at Gifford. In terms of our performance indicators that we report to the district, 100% of our 2-year-old health department clients were fully immunized. We love vaccine. Certainly our CHD, STD cases treated within 14 days of lab collection date, 88.14. Our core epidemiology measures, this is disease control, and our follow-up on our communicable disease cases, 88% was our 2018 performance target of 75. Our percentage of WIC infants ever breastfed, this is at 87.76. This is a rise of 4% over the previous year, so there's been very good work that's been done in this area. In partnership with Healthy Start, we've really made a tremendous difference. And certainly our customer satisfaction surveys with a satisfactory or better rating is 97.9 2018. And this is our 2019 data for the survey that we just did in terms of our customer satisfaction. And that is all I have for my report. Do you have questions for me?
I don't have any questions, but I want to make a comment because it is a bittersweet day, I'm sure, if this is the last day. You know, I remember working with Jean Klein, gosh, 20 years ago? I don't even know how long ago. Yeah, whatever. Working with Jean, first with the health department and specifically building the health center in Gifford. And the opening day, I still remember it like it was yesterday. And the health department has been a huge component of health care, primary health care in this community for so many years. And a lot of that is attributed to what you have done and the care that you've given in this community, Miranda. So I just want to make sure that you understand that we recognize how important and what you have done for the community. Change is difficult, change is needed. We cannot continue to the same, and I'm experiencing that even with my organization. So I just want to say congratulations and thank you and your staff for everything you have done over so many years.
Thank you. Thank you. Thank you.
Thank you, Miranda.
I have a question. Is it okay for me to ask? Can you hear me?
Certainly.
Yes.
Hi, Miranda. I want to echo what Karen said, but I also want to ask you a question about the future as we look at our budget for our upcoming fiscal 2020. We don't have any money applied for by the health department. Do you see a role where we could be of assistance to the health department in helping you complete your mission more successfully?
Well, certainly the work that the district does in terms of trying to address the people who are most in need in our county is tremendously important. And certainly, you know, in terms of now I look more at my role as the health strategist for the county. That is certainly what I'm charged with as a health officer. I do think it's important to be able to look at how you can break down barriers for the people that you serve and to be able to try to minimize those barriers so people get the care that they need. I think certainly with Cleveland Clinic, what seems that the hospital has done with the expansion of their care for indigent care has been tremendous from my understanding from what I've seen in these past few months. So I do think if moving forward in that spirit of breaking down those barriers to increase access to health care is tremendously important. As to a future role with the health department as to our services, I think that's something that we'll just have to see. I mean, certainly we are returning to our core public health services, but also expanding our work in HIV and AIDS primary care, which is tremendously important. We are facing multiple challenges now in terms of our hepatitis A outbreak that in which many counties within the state are addressing, as well as counties in the nation and states in the nation are addressing hepatitis A. So I think we've got enough to keep us busy. And I think that when we have issues within public health that are important for me to be able to update the district on, I will certainly do so. If you have questions about things that you would like a report from the health department on a certain area, we are certainly amenable to that. So I do think that as Gifford is changing and the relationship with Gifford is changing, so is the relationship with the health department. And that's something that we'll just have to see develop as we take on our new, well, not new services, but our change in services.
Miranda, may I?
Certainly.
Okay, thank you. We do work collaboratively, and that's very important. I think you said it very well this evening, to serve the vulnerable population. I would encourage you, just like Alan Jones just said, and I'm sure everybody on this board, that if you see a need and it is not something that the state reimburses in any way, because there are, just like the Hep A, which of course is you're addressing right now, but I would hope that you wouldn't hesitate to come to this board and put forth at least a proposition or propose something if there is a need and not go without. I think it's very important for this community to have a healthy community. You know that, of course.
Thank you. Well, certainly the district has chosen.
Yeah, if I could make a comment as well. You know, Miranda, the health department is one of the leading people behind the county needs assessment that's going on right now as well. And I think out of that is also going to come some things that, you know, we could help and be part of. And I think, as we've talked about before, getting us more attuned to those things that affect health, and you know, what are the systematic and public things that affect the health of the community and where we can have an effect on that. You know, we're going to rely on you to come back and help us with that. So we need that.
Well, I certainly appreciate that. And as you know and have stated, the health department is actually part of the county's response. They need there are multiple departments within the county that need that needs assessment. In terms of the affordable housing has to do a needs assessment every so many years. They're a portion of that. Children's Services is a portion of that. Certainly the health department, as well as several other organizations, and I'm excited to see that data come back. We are required by the state to do an annual report on our community health improvement plan, so certainly that's something that will be coming. And we'll look for opportunities to be able to bring you information as we see that pertinent. Certainly, one of those areas where we did ask for additional funding was in conjunction with Healthy Start for the fetal and infant mortality review. We've secured the case abstractor, which is someone who used to work for the health department doing that same type of work in previous years, Linda Young. So pretty soon she'll be starting and we'll begin that process. So I do appreciate, Anne Marie, what you said, and certainly we will definitely consider that.
Don't be a stranger.
Thanks so much.
Thank you. At this point, I will call upon Lindsay Fields, the CEO of the Visiting Nurse Service, to present her report.
Great, thank you. I just want to say, first of all, that we appreciate partnering with the district. We feel it's an honor and a privilege to be able to serve the healthcare needs of our community. And it's been a real privilege to really strengthen our partnership over this past year. And I just want to say thank you so much for that. And so looking at the budget and we've done the same thing as Miranda.
Little guy, oh, here he is.
Oh, there he is. Okay, he's hiding up
Just
there.
click on that.
Oh, brilliant. Okay, thank you. So we did the same thing as Miranda. We basically had results up to the end of June, so we figured we'd just give you the first 3 quarters of the year. And so you can see that we're, versus the budget, we're favorable by $68,000. This is primarily due to our home health. As you can see, is favorable $52,000. We had a really light third quarter with our home health services, which is pretty much drove that favorability. If you look at our hospice services in terms of the number of visits that we've made, so we have conducted 201 visits for hospice patients. This actually is down slightly from last year. At this point in time last year, we had made 218 visits. So, so you can see our hospice business is down slightly from last year. So moving on to our hospice quality scores, and we didn't really think these could go up any higher, but actually they have from the last time from a year ago. So our quality scores continue to climb further above national and Florida benchmarks, and so our hospice team does a great job, and people actually rate us quite highly on all of our hospice services. When we look at home health, you can see we've made 966 visits. And at this same time last year, we had made 1,198 visits. So we're down about 19%. But I wanted to point out one visit. So in the second quarter, between January and March, there were 181 visits. And I happened to be working with one of our home health nurses the day that we actually made one of those visits of the 181. And we walked into a home of a young lady who was being funded by the district. And I can tell you, it was the first, she had just come home from Indian River Hospital, and this was the first visit that the home health nurse was making. And when she actually realized that everything was covered from that visit, from that home health nurse, you could see just the stress and just the concern and all the anxiety for her face just like melted away. And the nurse was just there to take care of her, to address the wounds that she had. And it was just a beautiful thing to actually be there and witness the actual relief from someone who's receiving help from the district. So I just want to thank you so much for that. And again, on our home health business, we actually also above national and Florida benchmarks. And when we look at rehospitalization, which you all know is really hot these days, we are also below, which is a good thing, national and Florida benchmarks there as well. A real comeback this past year has been the mobile health clinic. And so through the first 9 months of this year, we've seen 1,622 people. We've had 1,622 visits to the mobile health clinic. At the same time last year, we were only 1,029 visits. So we're up nearly 600 visits, or almost 60% over the previous year. And obviously that's great part due to Pat Nipper's leadership of the whole Vulnerable Village. And she's just done an amazing job with the mobile health clinic, with the Positive Change program. And so I'd invite Pat to come up here and continue this presentation onto the Vulnerable Village.
Thank you, Lindy. Good evening to all of you, and thank you for having us here this evening. And it's been a while since I've seen most of you, and so just want to thank you so much for your continued support. So I actually have done my compilation from March through July, so middle March to mid-July, because I gave a very comprehensive presentation at the March chairman's meeting from October through March. So just wanted to let you know what my data was going to be about. So we've been focusing a lot of our efforts on, in the past 4 months, on the vulnerable village, continuing to build trust in these areas. And we think that we are succeeding in building trust because we have more people coming to the vulnerable villages that we've identified for Wabasso and Gifford back in last October. So I'll show you a little bit of that data in a minute. We have been completed our enrollment in the Positive Change Program. We actually exceeded it. Our goal was to enroll 30 patients by May 15th, and we actually enrolled them by the first week in May and enrolled 6 more patients because we do have some drop-off in patients, as you can imagine. We'll talk about that in a moment. We have also accumulated population health data now on over 570 patients that have visited the mobile clinic since October of last year, and I'm not going to go into that this evening, but I am going to send that to all of you in a separate PowerPoint, probably sometime next week. And we've also been focusing on supporting the Gifford Health Center, which everyone has talked about, so I won't go through. Tracy did a really great update on that, so I don't have to repeat that again. So just looking a little bit at our patient satisfaction, 98% of people that come to the mobile clinic say that they're satisfied and give, really great feedback about their experience. The 2% of people that represents that small slice of the pie are actually people that didn't respond to the question. So it's not people that said they weren't happy with the mobile clinic service. Our volume, as Lundy pointed out, has increased by 60% since last year. This volume is mid-March through mid-July. Again, looking at, you can see how we are way exceeding our volumes from last year. And that was mid-July. You can see last year we had 98 patients. We'll probably exceed that. We will have a little bit lower July because the bus was off the road for quite a few days with maintenance, and that was unforeseen. But we will still, clearly exceed 100 patients for the month of July. You can see here, I think this is an important piece of data that you are interested in, because if you combine GYAC, MLK, which is Martin Luther King Park, and Wabasso, which has had a very big increase in patient visits. If you combine the 3 of those, clearly the vulnerable villages that we identified in our proposal last October are leading the way in terms of who's coming to the particular sites where we are located, followed by Oslo. So there's really no surprises there, really. Oslo has always been a big site for us in South Vero, and so we continue to see the volume pretty much where we've been in the sites that we've maintained, but in the sites that we've changed to, we've seen a significant growth in the last few months. We continue to see mostly patients that are unique visits. So you've all asked in the past, do people come to the mobile clinic repetitively? In mid-March to mid-July, only 19 patients came back, and each of those 19 patients came back just one time. So the majority of patients are coming one time. They're predominantly, we see sick visits. Now that number will change a little bit in the subsequent 3 to 6 months, because we'll be doing a lot of physicals for returning to school and sports and work and things of that nature. But about 70% of our visits are sick visits. It's the usual types of sick visits that we see: colds, flus, UTIs, skin rashes, bug bites, ear infections, eye infections. So same things that we see. And we continue to receive, a lot of positive feedback. That's the Allen Chapel in Wabasso. We're parked there every Monday, and that's been a really good location for us. And we move now on Monday evening. We leave there an hour earlier, and we actually go to the Gifford Health Center for 2 hours on Monday evening. And we've been seeing on average about 5 patients in those 2 hours alone at the Gifford Health Center. So that's actually been positive as people are coming up and trying to figure out what's happening with the health department. Our age demographic, our median age of all patients is 32 years old. If we take out the children 0 to 18, we still have a very young median age of 35 years of age, and that data plays into how many patients are connected with the primary care physician, how many people have a regular routine for their medical care, and so forth, which we'll talk about in a minute. Insurance, so we ask the question always of our respondents, and by the way, this is 447 respondents that we have survey data on. So we have 77% of our patients tell us they don't have any insurance at all. They have no coverage at all. Most of these people are working. The majority of people that come to the mobile clinic are working. And they're working 2 and 3 jobs at minimum wage jobs, and they don't have insurance. If they do have insurance, we ask them, well, why are you here at the mobile clinic? And it's pretty much consistent with what we found the previous 6 months. They couldn't get an appointment somewhere else. They couldn't afford the copays. They needed a fast and convenient place to go because they needed to return to work. A lot of times people tell us, you know, it takes several days to get into a place, a physician or a clinic or somewhere. It's not always easy, and so they have to get back to work, and they want to avoid going to the emergency room. A lot of our patients, they don't want to go to the emergency room. A lot of them do, but some of them don't actually want to do that. We do have a low number of patients that have the Financial Assistance Program hospital district number. We don't really know exactly. It's something I'd really like to explore, you know, in the next number of months, why that number continues to be low, but it is low. Part of it, I think, is because we don't have an infrastructure to be able to, although we've, you know, Jenny's been great and she's come to the mobile clinic to train us and so forth, but we just don't have the staffing infrastructure to be able to do that. And the patients, even though we give the application, explain the application in great detail to every patient that comes through that doesn't have insurance, very few, if any, really come back to say, here's, you know, my paperwork, or I went and followed through. So where do our patients typically go for health care? Again, the emergency room. You've seen this many times, so I'm not going to go through every single detail of this, but you can see from this slide to this slide, which is if there was no mobile clinic, where would you have gone? The data is almost consistent as to where they typically go and where they would have gone if we weren't there. So this number was a little bit higher in the first 6 months of the year before we changed locations to Gifford and Wabasso. And we surmise, although we don't know for certain, we surmise a little bit that reduction in people that go to the emergency room is because we changed locations, and perhaps, we don't know for sure yet, but perhaps a number of people that live in Wabasso and Gifford don't frequent the emergency room as often as some of the people perhaps that are living in the Oslo location or some of the other locations that we were going to. We would like to explore that as a piece of information as well in the future, but typically that number is more between 23 and 26, so it's sitting at around 20 right now. And I emphasize the weighted because the 10% of the people that said they would have waited, that's weighted for the mobile clinic, and we believe if there was no mobile clinic, a percentage of that 10%, if not all of that 10%, would probably be going to the emergency room if we weren't there. We asked people, you want to know who we've referred to a primary care physician. So of the people, if you look at this pie chart to the right, 73% of the patients that we see actually don't have to be referred to a primary care physician for follow-up. But there's a differential there because we encourage every patient that comes to us to establish with a primary care physician. But this is actual data about who we've referred. 20% of those people do need to be followed up either on the condition for which they came to us or because we found something such as hypertension or high blood sugar, some disease state that they disclosed to us. And so 20% of those people tell us, yes, we'll follow up, although we're finding that a great deal of them don't follow up. And 7% of the people tell us, I know you want us to follow up, but we're not going to. So basically we refer about 27% for direct follow-up. Again, it's patient choice, so we tell them they need to go somewhere. And that's what we're finding. For those that have disclosed that they have a regular primary care physician, 77 patients listed a physician, 30 patients cited the health department, and you can see 37 people cited they go to TCCH, 24 patients said, gave no specifics, and 1 said they go to the whole family health center. Again, our demographic by age, you can see the younger the patient is, the less likely they are to be established with a PCP. That climbs as they climb and age, when they might have some chronic conditions for which they need to see a primary care physician. The number that is most troubling is the 0 to 18-year-old population. 56% of the moms disclosed that they have a primary care physician for their child. That means 44% of children in these locations have a family that does not have the means to have a primary care physician for a child. And that's a really scary number to us on the bus. The Positive Change Program, I'll just go through this very quickly. Again, we met our enrollment of 36. We've had, actually that number has since climbed in the last couple of days. We now have had 18 people that have returned for their 30-day visit. We have 9 patients that have returned for their 90-day visit, so 9 patients have gotten exercise trackers. And you can see we have people continuing to come. They're coming, many people are coming every 2 weeks, some are coming every week. They really want the support of the nurse practitioners, and that's been extremely valuable for our patients. The top goals of the participants, I did this at the last collaborative meeting, no surprise. Healthier food choices, increasing activity, stop smoking, eliminate soda, increase water, things of that nature. These are the goals that most of us have when we want to make healthy lifestyle changes. This, I think, is really important because this is what we're doing and the corollary for what the participants are doing, okay? So we're educating, we're finding that they're very receptive to learning. We're creating awareness about choices. They're journaling, they're tracking their successes. They're helping us to understand how we can help them. We're customizing care plans. If they come back every 2 weeks, they leave with a custom care plan every 2 weeks. That's going to be incremental goals that they can hopefully achieve before their next appointment. They're working with the APRNs to create those achievable goals that lead to those subsequent visits. We're connecting participants to clinical and social resources based on their feedback and needs. They're following through, although not always, on APRN recommendations. We're validating them in a lot of ways because the participant has healthcare needs, and a lot of them have expressed to us they have wants to be more healthy in the future, and they feel that someone cares about them when they come to the mobile clinic and they meet so one-on-one and so intimately and intensely. Some of these appointments take 45 minutes to an hour. They feel really validated that someone cares about their health care, and that's been something that's been really important to our team. And then we provide realistic, achievable short-term goals to encourage them, and they're expressing willingness to accept that this is a pathway. It's not something that, in 3 weeks they'll come back and they'll have lost 10 pounds or they won't be smoking anymore or whatever the case may be. So that's been an extremely important aspect of this program. And here's 2 people that have signed releases and allowed us to use their photos because they were so excited that they reached their 90-day challenge, and they got an exercise tracker, which we promised them, and that was donated through the generosity of one of the VNA donors, which we're very happy about. And so we had one patient, I can't use anyone's name, of course, but a female patient who was in the program, enrolled in February, went through March. Highly motivated person to make changes and sustain them. She actually stopped smoking cold turkey, which was, I was a former smoker, it's very hard to do. And she did that and sustained it for 30 days by coming and continually communicating. She decreased her sugar intake at the same time, which is even more hard to do, and increased her physical activity. The second patient had a goal, motivated to make those changes to support a pregnancy. She's lost 33 pounds. Despite the challenges, she's maintaining a commitment, and she has established with a primary care physician. So that's kind of an overview of what we've been doing for the last 4 months, and I thank you for your time and attention to listen to.
Have you been busy? I'm kidding.
Not really. We could take on a little bit more. So thank you.
Congratulations.
Thank you
Yeah,
very,
I just
very
think
much,
it's so
all of
great
you,
that
for your
that
continued support. We
the
appreciate
bus has been revitalized. I think that's just a huge comeback because it has always been an important part of our community, and for you to be able to manage through all of this is great.
How's the bus holding up?
Thank you for your support. Well, the bus is holding up. We had some challenges in July with some maintenance issues, but we got them resolved, and we're hoping, it's...
And you have new equipment now on the bus that was
new
funded
medical
through.
equipment on the
Right.
bus that we continue to
Okay.
order, and we have our new exam table actually came in today.
Right.
With thanks to the Johns Island Foundation. Our new
Right.
exam table came today and is going to be
Yes.
installed on Sunday. And we have, a lot of new medical equipment and a scale and, new filing cabinets, and it looks good. It really
Pat,
does.
how old is that bus?
It's 15 years.
15 years,
Yeah.
that's what I thought. How
Yeah.
many miles on it?
So it has, I'm not going to say it now because I thought I knew it, and now I'm not 100% sure. I believe it has 45 to 55,000 miles, somewhere in that
Oh, is that all?
range.
Oh, that's not bad.
Because we don't, yeah, we were kind
Yeah,
of
you're
going
s-
around
yeah,
in town,
you're
and
good.
it's
Okay.
stable,
Okay, that's
it
fine
sits
then.
wherever we go. But that has a flip side too, because when you're not really traveling and doing road travel and so forth, sometimes you're subjected to, the bus is subjected to, more problems, because it's doing short-term runs as opposed to those
You need to do
long-term
a-
runs that,
need to
run
do a
just
road
like a
trip.
car, where you run the engine. So, we've had a few challenges. It can go a lot of miles, but it needs, a lot of maintenance, and, we have to make sure it's safe. That's the most important thing, making sure it's safe.
Both of those buses, the original one and that one, had been funded by the district in
That's
years
correct.
past.
That's correct. Both of the buses
Exactly.
have been funded by the district, yes. And we thank you for that. Thank you so much.
You guys have made some lofty goals over the last year, and Pat, you and Lundy have been very busy working not just with patients in the community, but other organizations in the community, creating relationships with them. And I just wanted to say, you guys have done a phenomenal job of not just with the Vulnerable Village and revitalizing the bus, but really making relationships that are filling gaps for access to care and kind of breaking down some of those barriers. So I just wanted to say thank you for working so hard.
Well, thank you for that. And like you said earlier, Tracy, it's not really about us. It's really about the people that, are coming together. It's amazing how many people have come into this Together for Health Collaborative, because one person tells another person and somebody else comes, so I'll give you an example, if I may. We had a Gold Star mother who came to our meeting last week, and she was referred or came in through Marty Zickert, and as a result of that last week, I'm actually meeting with them and Nick Capolo, and we're going to talk about maybe adapting the Positive Change Program for some of the young veterans who are suffering from PTSD. So it's a round robin, there's housing has been obtained for people through the wonderful McCabe Connection Center, learning about the Senior Resource Association, all the things that are available in our community. I think we're just beginning to even touch on how we can make all of those connections for all
I think that's half the battle, is people don't understand all that is available to them. And so connecting people together to spread and communicate where the access to care is, I think is so vital. I think that's something that we really need to make a priority in this upcoming year.
Well, thank you again, all.
But also, Pat, your leadership has been just incredible, leading your team and your dedication to what you're doing. I think it's very important. Not everybody will put in that kind of time and effort, and so congratulations on that.
Well, thank you, and I thank all of you, and I thank the VNA, and I thank Lundy, and everyone at the VNA, the board, for supporting us, in making these changes, because as you said, there were some lofty goals, and, we met a lot of them, and we still have ways to go, but we really I just can't thank everyone enough, so, thank you.
Thank you.
Thank you very much. At this point, we have unfinished business. If not, we will go to new business action required. TCCH proposed adjustments for sliding scale. Vicki, Mrs. Soleil?
Good evening. For the record, I'm Vicki Soulé, CEO of Treasure Coast Community Health. Before I get started, I do want to say thank you for the cooperation of Tracy and Anne Marie and so many others that have made this transition coming back into the Gifford Health Center with a new set of services so much easier. We're really, really looking forward to the reopening of Gifford Health Center. I'm counting down the days, as are my staff. But I want to talk to you tonight because Treasure Coast Community Health continues to experience substantial growth, with an additional 5,000 patients expected to visit Treasure Coast Community Health in 2020. Unfortunately, there will be no additional federal funding for that. We receive the same amount regardless of the number of people that choose to see us, and insurances continue to ratchet down payments and deny claims. Over 10,000 of the 24,000 current unduplicated individuals who see us have income of less than 100% of federal poverty. That's 10,000 out of 24, so it's a significant number. About 2,900 medical patients qualified for district funding last year in 2018. Treasure Coast Community Health does seek grants and would welcome additional philanthropic support, but at a minimum, and for the moment, Treasure Coast Community Health depends on our tax district for support in providing medical care to uninsured, lower-income residents. We currently ask for a nominal fee of $25 for medical services for those under 100% of federal poverty level, and we do offer a sliding fee scale for those who have incomes up to 200% of federal poverty level. In 2018, however, 20% of our patients could not afford to pay anything for the services, but were seen at Treasure Coast nonetheless. Hence, our funding request, submitted in April, was for an increased amount over last year per qualified individual. However, I want you to know, I have been listening carefully. Mr. Jones and many of you have advocated for more affordable nominal fees and discounted fees. Our board members, the majority of whom use our Treasure Coast Community Health Services, have listened. So, after much number crunching and gnashing of teeth and more number crunching, we would like to propose a collaborative approach to this. If the district is willing to add a portion of the patient-paid fees to our reimbursement for this low-income population that qualify, TCCH will not ask any district-qualified patients for any nominal fees or sliding fee scale charges. In addition, Treasure Coast will reduce the amount asked of non-district qualified patients with incomes below 200% of federal poverty. We'll drop a separate charge that we've had for labs and other ancillary services, which have been discounted but add on to the office visit, and we will absorb the balance of the fee reduction's income loss, hence the tooth gnashing. So while this has been sparked by the Gifford Health Center transition, it will benefit the entire community. Many people who have chronic conditions are not able to come in regularly. This would allow them to come in and manage those conditions before they get worse. Many children, much to my surprise, who are legal citizens, are not enrolling for Medicaid because their parents are afraid, basically, of what's going on, and their families cannot afford to bring them in for pediatric visits without that Medicaid coverage. So they are missing out on the preventative shots, and I think Pat's data supports that in terms of the number of children who are uncovered. Together, I believe we could make a real difference. We would like to institute the fees you see before you that were handed out ahead of time, effective with our GHC opening date on August 26th, with your assurance tonight that this increased reimbursement might be applied to our funding request. Thank you for your consideration, and most importantly, to your devotion for the betterment of our community.
Vicki, none of these patients that you're requesting the additional funding for would qualify for any kind of Medicaid because, in other words, none of these patients are Medicaid.
Correct. None of the patients.
Okay, I just needed to establish that.
Correct.
I think it's important.
We will always be the payer of last resort.
Right.
We will always try to get
Right.
individuals qualified for Medicaid, Medicare,
Right.
disability income first.
Right.
But then we know that when your 200% comes into play October 1st for funding, the same as ours has been, anyone who qualifies for the district would again, be covered under our sliding fee scale, not Medicaid.
So, Vicki, you're asking for another $62,572, is that?
No.
No, what is
And
it?
I think we should probably talk about the numbers at the chairman's meeting as opposed to here, since you didn't have an opportunity to go through this.
Fair enough.
Okay?
Yeah.
Okay.
Okay.
I've sat down with you and Anne Marie and the advisory committee, and to see you guys activate on this so quickly and then be able to come back to the trustees in hopes of getting this fulfilled and approved and everything by opening day. I'm so excited that you were able to pull this together as well as work towards the transition and opening day. This is phenomenal. I haven't seen this quick
footwork in a long time. Well, our board needs kudos. They met last night, again, specifically on this topic. It's very important to them to do the right thing in conjunction with the district's vision. And so, again, in sort of a tandem partnership, this is why we have brought this forward to you for your consideration next week, so that on opening day, hopefully we will be able to, or before, we'll be able to announce the prices that go with the menu.
So then, I guess I would like to make a motion to approve, I'm not sure how we're going to word this.
You should, I would recommend that you approve the addition to the cost per service or the reimbursement per service, and this eligible sliding fee scale for those that are not qualified for the district funding.
Okay, that sounds right. With the understanding that you're going to come to the chairman's meeting with more specifics.
Right,
Oh.
what that will mean for
I mean,
their
the
current
budget-
funding
the budget.
request and the budget, right, because there will be additional.
Approval of any sort tonight, I'm sorry. Why are we
Yeah.
not having
You want-
discussion at the?
And you certainly can.
We didn't have a chairman's meeting this month, and this would have been very appropriate.
Well, we weren't ready
We had
then
had that
because
meeting.
You just had the meeting
We
last
did
week.
not.
They just
No,
had the
we
meeting.
have been meeting regularly, but the lack of chairman's meeting. The whole thing hinges on an increase over what we had asked for, and that certainly is something that you all should discuss.
But
But-
you're
but
going to
what we're
be in
looking-
there August 26th.
That's right. So do you
So unless we pass
approve
this
at least,
now,
right,
it
this?
will not be in effect until after the September.
Because TCCH needs the approval of the hospital district to move forward with presenting to the board
Altering their sliding.
with altering their sliding fee scale. Which,
Okay,
if
you-
it's not approved, I don't know, Karen's trying to play catch-up.
minute.
If this group decides that what has been presented tonight, after discussion, is not palatable, then we can always pull back, okay, and not have a reduced sliding fee scale. We can pull back our ask, okay? But again, looking through all the material, I think will bring you to the point that you asked for.
I think absolutely. I know Alan was very, very strong about people not being able to afford and staying away because of what was in place. So I think this will be an added incentive for people to come to the Gifford Health Center for their care. with
Or any TCCH facility, because it will be across all their
across-
sites.
Across the board, but I do know there was some problems.
And I will add that I would encourage the discussion after having listened to a number of the presentations about people's unwillingness to go anywhere that they need to provide qualifying information. Only half of the patients we saw qualified for this, and it's not because, for district reimbursement, and it's not because they live outside of the county necessarily. There is a dichotomy between wanting to do the right thing and lower the price for everyone, and making it so low that there's no incentive to register for the district or the hospital. So that's my revelation after sleeping on it last night. So it really deserves your concentrated discussion and understanding of the pros and cons for our community.
I just wanted to get one thing straight. You don't have exact numbers. You said you have to come back with us?
No, I have exact numbers, but I don't think this is a proper forum to hash those things
All
out.
right, so I don't know how we can vote on something if we don't know the full data.
And that's to my point, I don't think that it's
No,
necessary to
I think
approve
the
anything at this
chairman's
point.
meeting is where,
think we
I
should-
agree.
Absolutely.
now I don't know about the next chairman's meeting. We've sort of put an awful lot of information into that meeting
It's a
on
budget
September
meeting
3rd.
on September 3rd, right?
Yes, it's a budget.
Yeah, it's going to be an all-day affair, I think, Mary Beth.
Yes.
It has to.
I'd like to make a comment if I can. First of all, thanks to Treasurer Coates for doing this. Secondly, while we've got more numbers to crunch, they're proposing, as I understand it, $153 per patient, per medical patient charge, which is about the same we pay, that the whole family is proposing, and about the same we used to pay the health department. So
Right.
to me, that equalizes things. Third, our round number calculation so far is in the $100,000 area, which we could definitely afford. And fourth, it is consistent with what Cleveland Clinic is doing, so that patients don't have to have some sort of checklist on where they're going and what the fees are going to be. And fifth, in terms of total overall health of the community, I think this is a giant step in the right direction. And so I'd support it for those reasons. So agreed, we have to look at the numbers and crunch them on the September 3rd meeting.
You could approve it in concept and then
And I
come
think
back
that-
and
and I think that's
reserve
the point.
approving the number.
And that's why I added, you know, based on coming back with numbers, I think approving the concept so that her board can vote, and then she's coming back on September 3rd to give us numbers.
Our board has already approved what has been presented to you and Anne Marie, and what is here before, the simplified version, before the rest of the trustees. They are okay with this and have approved it at the special meeting last night. So if you want to defer to September 3rd, that's fine. Our goal was to try to open up Gifford Health Center with the reduced fees that would then spread across all of our centers.
Right.
But if you want to wait until September, that's okay. I understand.
Yes.
No, I agree we should do it now in concept, and then we can fix it if we don't approve it.
Sooner
What
the
you're suggesting now,
Well, I think they need to get started though, and if we don't approve it later, that just messes up. They can't start and then take steps back. They either have to start this way or or not. So I think we have to not just agree in concept, we have to agree that we support what it is that they're going to do.
I agree.
I agree with
I line up for supporting it.
so you're suggesting that what we do is if all in agreement, we would approve the concept tonight and discuss the dollars later.
on Thursday.
But
We discussed.
Yeah, but I think what we're saying is we're gonna have to approve the dollars as well, and from what Alan said, it's not something out of the realm that is going to shake up our world going forward either. That's what I heard from you, Alan, is that right?
Yeah, no, I agree with that, not only in terms of total dollars, but all it does is equal what we're paying different providers for the same services.
right,
And we've paid the health
Right.
department this amount. We are proposing to pay whole family this amount. It's just equalizing things, and we get a lot more benefit for the patients.
absolutely. We commiserated, we struggled over this. I'm ready to pass on this tonight. I do want everyone to realize that this is just one of probably many things that will come our way in the next few months. And remember what you did, or what we all did, in reducing the millage rate. So, but I do think this is a good start. We need to do this for the patients. I had to say that, I'm sorry, okay? I had to
Are
say
you
that.
seconding the motion, Anne Marie?
Oh,
You had to
I
get
didn't
that.
have a second to your motion.
Get that in.
I'll second it.
Thank
I think we have a fiduciary obligation to the taxpayer to see exactly what we're buying. And in order to do that, we have to see the numbers. I mean, we're gonna be asking for a blank check, basically. We don't know. what the
No,
numbers
you're not.
I don't think it's a blank check. I think we're buying patient care for crying. Oh, please.
Well, what are the numbers?
I think what you're buying is a per patient charge right now, and that's what we're agreeing on.
Correct.
Right, and you can approve the number at a future meeting.
Thanks for working on that too, Vicki. That
Thank
took
you
a
for
lot.
your
Thank
support.
you.
Do we need to take a vote?
Yes.
Yes.
We have a motion on the floor.
Who seconded it?
Alan seconded.
Good.
And what is the motion?
Motion is to approve the addition to cost per service and the eligibility sliding fee scale
Pending the
as presented.
pending the details.
I don't think that was part of the.
I don't think it's pending because they're
It's
going
not
to get
pending.
started with it on August 26th. Is that correct? We will not be meeting.
That was our intent, unless we could come into the August 23rd meeting to discuss further.
Right, because you can.
So I have one question related to that then, and that would be, Alan, if they start this across the board on August 26th, can between August 26th and October 1st, I mean, we're okay as well, right? Financially?
The money,
Well, we would be, though I understood, maybe I misunderstood, but yes, the answer is yes, we would, though I thought TCCH was going to pick it up until October 1st, and then we have it in next year's budget.
No, that
don't
was,
think
But either
that
way,
was
we
in
got
your-
plenty.
that was in your approval of the RFP. We already put aside money in this year's budget to get us to October 1st, from start date of the services.
Oh, okay.
Now, August 23rd.
Oh, no, but this
It's-
would be across the board though, and that's a different issue.
I think that we have $6 million in our account, so, I mean, I can defer to Alan as the treasurer, but I think that we have those funds, aside of the fact that at this moment, TCCH is running under budget for the year, so they have probably ample funds in their budget, and along with the additional funding that we approved
I
for
just
the gift
want to
horse.
be clear that we understand that August 26th, and Vicki, you verify, you intend to do this across the board,
Across the
right?
board.
For people up to 150%, because we have not, you have not raised yours.
Right.
100. So our submission.
And then effective October 1st, it would go to 200%.
Correct.
So as of August 26th, you're going to raise the rate from $98 or whatever it is to $153 per individual. That's what you'd be
District.
charging the hospital district.
For district-qualified
For
patient.
district qualified up to 150%, until October 1st, when the 200% kicks in. And what that's going to do is, there will be no fees charged to the indigent, the under 150%. There will be no lab fees charged to anyone.
Correct.
And in addition, there'll be
To those district
to
qualified.
those district qualified, and then those that are above that amount will have a slightly reduced sliding scale fee.
Not those above that amount, those that are not district qualified. For whatever reason, they're not district qualifying, they would use this sliding fee
that
scale that's in front of you.
Right.
Right,
Absorb
which
the
is a
fees for the
reduced,
reductions.
and Treasure Coast would absorb that.
Right.
Yes,
And in the meantime, we're moving
So-
towards a healthier community.
agreed.
you're going to waive that $25 fee.
It should create an incentive as well to be qualified, right?
Absolutely. An incentive to fill out the papers and be qualified
That's a great,
appropriately.
great
What
point.
would we be discussing at the chairman's meeting if we're going through all of this now? What?
There is, that's right, it's not, the September 3rd meeting, when you discuss your budget, we'll talk about the numbers that will need to be added to the Treasure Coast budget, because their cost per service times the amount of people that they're going to see is going to increase that
Obviously,
budget.
it's going to increase, but
Right.
we don't know what it's going, we don't have that
We will
number.
talk
There's
about
some-
that September
So
3rd.
what happens if we figure out that we really don't, not that we don't have the
Well,
money, but
You go get a grant.
Keep in mind, the Department of Health is not asking for budget funding. The Health Department is not asking for budget funding, and TCCH is absorbing a lot of those patients. And what they're asking for per patient, to Alan's point, is not different than what we pay to whole families and what we pay to the Health Department.
Once again, Vicki, you did a
Okay.
great job.
great job, absolutely.
Now, what happens at the department?
Trying to please a number of
We have
different
to have a
bosses.
vote here.
Yeah,
We
call,
have to have a
We can
vote.
call the question.
call the question.
Yes, we've had a discussion, so now I'll call the question. All in favor?
Aye.
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 Okay,
Aye.
okay, so then it's passed.
Thank you all very much.
Congratulations, Vicki, you did a good job. And thank you for
Thank you.
all of those patients that are
Thank you,
going to
Vicki.
qualify.
We're really looking forward to being able to remove barriers to care.
Yeah, you,
That's what it's
you,
all
you
about.
did good, Vicki.
Yes, I should tell them about all the people that have been coming to the center. I have nicknamed one of my employees the Walmart greeter, because he's there at the center to
help with the tradespeople in and out, and about every 10 minutes, he goes to the door because somebody's knocking, usually a mother with a little child, to get services, and he explains to them, or has been explained to them, to go to the health department, and they're all like, but when can I come here? So the community's responding.
Very exciting. It's very.
Jennifer, do I need to call point of order since there was no request for nays?
You can do that, yes.
Okay.
I asked if there were any opposed, but I don't know if anyone.
No, there were no opposed.
So it passed unanimously? Okay, thank you.
Everybody.
Thank you all very much. Have a great evening.
Thank you.
I guess, do we have any new business? Do we have any public comments?
Did we call for public comment?
Public comment?
Yes, there is someone, I think.
No. She's signing out now.
Please, Jennifer.
No public comment, no other business before us. Can I have a motion for adjournment?
So moved.
So move.
We'll take a vote. Everybody approve of that? Yep. Okay. Meeting's adjourned.